Ready?
Okay.
3, 2, 1.
Hi, my name's Jennifer. I'm your nurse practitioner with Smoky Sesame. How are you feeling?
Feeling good.
Good. So I'm gonna wash my hands. Patient is pleasant, dressed appropriately for her age and the weather outside. Skin is pink, warm, and dry. A little redness on the chest. I do see a couple freckles on her right forearm, and I am going to measure them. Less than 2 millimeters. No irregular borders, soft, smooth, no drainage, any tenderness at all. Okay, so I'm going to look at her face and her head. Any tenderness on my crest. Light brown, no nodules, no masses felt. Can you smile for me? Sensation or symmetric facial movements, no involuntary movements. Have you opened and closed your mouth? Any pain, tenderness at all?
No.
Okay. And then I'm going to have you clench your teeth. Okay, and H is strong. And then I'm going to have you close your eyes, and then tell me if this is sharp or dull.
Dull.
Dull. Okay, and that is symmetric sensation. So then I'm going to look at her neck. Any pain, tenderness, no nodules felt at all. Okay. And then I am going to look at her, check her thyroid. Any pain, tenderness, I'm going to have you swallow. Okay, and then fill behind as well. Okay, and then I am going to press against my hand. Okay, and do the other side. And then try and shrug. Okay, and then I'm going to look at her lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and then supraclavicular. Supraclavicular. Then I'm going to look at your eyes. So I'm going to have you tell me when you can see my fingers.
Now. Now.
Okay, and then I'm going to have you look at my finger and then follow it. Okay, and then I am going to do a corneal reflex. So I'm going to shine a light. And I see a symmetric reflex. And then I'm going to look at your eyebrows, and they are symmetric, evenly distributed. Look at your top of the fissures, and the width is normal. Have you open your eyes, try and close. Okay, and that's symmetric. Your conjunctiva puncta is pink, no drainage noted. Eyelashes are symmetric, evenly distributed. And then I'm going to look at your eye. So then I'm going to turn it on. And then I see the red reflex. I'm going to follow that in. I see the vessels. And then I'm going to follow it to the optic disc, which is round, oval, orange, no papilledema noticed. Okay, any pain, tenderness at all?
No.
Okay. And then I'm going to look inside your ears. In the ear canal, I don't see any swelling. I see the corneal light, which is a pearly gray. I see the umbo, the handle, the malleus, and the short process. I see the tympanic membrane, which is intact, no redness, no drainage, no noted. And then tell me if you get this on both ears.
Yes.
Okay. And then tell me where you don't hear that.
Now.
And then tell me when you don't hear it again.
Now.
Okay, so bone conduction is longer. And I'm going to do the whisper test. So I'm going to have you include this ear and then
538.
And then I would do that on the same side as well. Nose, I see is symmetric, no obvious lesions, pink, any tenderness at all?
No.
Okay, so then I will look inside, and then I don't see any, the septum defect. Ooh, the septum is not deviated, no ulcers, no bleeding. Have you occlude? Deep breath. Take a deep breath. And that's symmetric. Any pain, tenderness right there?
No.
Any pain, tenderness right there?
No.
Okay, sinuses are non-tender. And then I'm going to transilluminate each side. And see transillumination. And then I'm going to look in your mouth. How do you say? Open up. Mucosa is pink. No deviation of the hard, soft palate. Stick your tongue out. Say ah. Uvula is midline. Teeth are intact. No cavities. No broken teeth noted. And then I would have you lift your tongue, and I don't see any lesions, and then I would just move it side to side. No, nothing tenderness, no white patches noted. And then I would look at your tonsils. Again, I see them, they're present, they're not enlarged, no exudate. Looking at the pharynx, and it's pink, no drainage, heavy swallow, and she can swallow, so she has a gag reflex. Okay, so then, have any pain, tenderness at all?
No.
Okay, so then I will have you say 99.
99. 99.
Okay.
99.
Okay. And then I will listen. Respirations are even, unlabored. No audible sounds, no wheezing, no rails, coarseness, or some respiratory distress. Okay, lungs are clear, so then I will go any pain, tenderness at all?
No.
Okay, and then I would have you say 99.
99. 99. 99. 99.
Okay, and then I will percuss on each side. And all resonant, no dullness. I will do the chest expansion. So take a big deep breath in. Okay, and that is symmetric, equal. Again, and then I will tell me if you have any pain.
No pain.
Okay, and then I will listen again. Take a big deep breath in. Lungs are clear. So then I will move to her. Okay, then I'm going to have you lay all the way flat. And then I am going to check for JVD. So I see no obvious JVD noted, no distension. And then so I will find her jugular vein and then measure this. And it is less than 3, so that is normal. I will listen to all fills. So I will listen to her aortic, her pulmonic, herbs, tricuspid, and her mitral. And then I would listen to her apical pulse, guanyamaxillary impulse for a minute. And then I would have you, and then I would also listen to all those points with the bell as well. And I have you lay cheer on your left side. And then I will listen to your mitral, and then your tricuspid, and then have you sit up, and then have you lean forward, and then listen to your aortic, and then your pulmonic. And then I would also feel any thrills, any vibrations, no heaves noted at all. Okay. So then I would look at her nails. No, I don't see no clubbing. Calf refill is less than 2 seconds. Skin trigger is automatic. No tinting. No edema noted. So then I would feel for all her pulses. So I would feel her carotid, her brachial, radial, and then I would have her lay back down, and then check for her femoral pulse, and then check the popliteal, strong, and then
Sorry.
check for the posterior tibial, and then check the dorsalis pedis, and all pulses are 2+, regular, even, sorry. Okay, so then I will have you lay back down. So inspecting your abdomen, no lesions noted, no open areas. So then I would look at your umbilicus. I don't see any bulging, so no signs of hernias. And then I would lightly, and then I will listen to all quadrants 4 minutes. 4 minute. Vowel sounds are active. And then I would do, okay, so then I would percuss, looking for the liver span. I would start low and then go until it was dull, and then start up and then go till dull, and then I would measure that. And then I would also percuss for the spleen as well. And then have you take a deep breath, and then I would percuss again to check for any dullness, and then I feel no dullness, and then I would do your bladder as well, and it's resonant. I don't feel any or hear any dullness. And then I would do light palpation, any pain, tenderness. And then I would do deep, looking for any masses, any pain at all.
No.
Okay. And then I would do the hook for looking for the liver, checking the liver, and I don't feel any swelling or any enlargement at all. And then I would also feel for the spleen, and I don't feel anything. And then again, I would feel for the kidneys on each side, and I don't feel anything. Alright, so then I will have you sit back up, and we're going to test your range of motion. Looking for the tone and the strength as well. I would look for, or I would inspect and palpate for any pain in all joints, any deformities, any nodules, any lesions at all. Okay, so then I'm going to have you flex, go all the way up, extend, abduct, then we're going to cross your body, do internal rotation, and then external rotation. Okay, so then I'm going to check your elbow, and I'll have you flex, extend, supination, and then pronation, and then I will have you flex, extend all the way, abduct, adduct, and then squeeze both my hands, fingers, and strength is normal, adequate, and then press up against my trays. Okay, strength is good, normal, And then we're gonna check your neck. So I'm gonna have you flex down and then tilt your head all the way back and then rotate, look across your shoulder each side and then lateral bend. And then I'll have you stand up. So I'm gonna have you touch your toes. Okay, and then stand back up and then bend backwards. Okay, and then rotate over each side. And then laterally bend on each side. Okay, and then I'll have you sit back down. And go ahead and lay all the way back down. We're gonna check your hips. So we're gonna flex all the way. I'm gonna have you touch your, okay, out, down. And then we're going to abduct, and then adduct, and then internally, and then bend your knee, and all the way, or internally rotate, and rotate. And then we're going to do your knees. I'm going to have you sit up on the side of the bed. So straighten your leg all the way out, and then bend it. And we're going to go in, out. And then with your ankle, we're going to go flex all the way down, up, and then we're going to flex in, out. Okay, all right, and then I'll have you stand up, and I'm going to have you close your eyes for 30 seconds. Posture is good, no tilting. Okay, go ahead and open. Have you walk a couple steps, and then walk back. Posture is good, has a normal arm swing, and then I'm going to do the heel to toe. So walk heel to toe. And then walk back. Posture is good, able to control movement. And then so we're going to do that. And then close your eyes. And then arms are able to bounce back. Okay, and then open your eyes and then touch your nose and then touch my finger. Okay, and then do the rapid movement. So go ahead and sit back down. Okay, all right, close your eyes. And then tell me what that is.
Paperclip.
Okay, and then tell me what I draw.
Three.
Yes. Okay, you can open your eyes. Okay, all right, I want you to tell me if this is sharp or dull, so go ahead and close your eyes.
Dull. Dull. Dull.
Dull.
Dull.
Okay. Well, then we are going to check your reflexes. So I'm going to check your bicep and then do your tendon, or your tricep, my goodness. Okay. And then your check your knee. And then check your ankle. Pain tender as well. Okay. And then I will go ahead and lay down. And then all four quadrants. And then I see a contraction in all sides.